we hear about dementia, and I'm just going to briefly explain what dementia is. I will use that term throughout this presentation because it's easy to say. But dementia actually is not a diagnosis. It is just a collection of symptoms that relate to cognitive functioning. And to put that in further perspective, everyone has heard about Alzheimer's disease. Alzheimer's disease is thought to be the most common type of dementia. So dementia is the overall umbrella term, and then there's different types of dementia. And there's thought to be 60 or 70 different types of dementia. So, and for a lot of people, particularly as they age, there are combinations. They call them mixed dementias, so someone has more than one. And the one thing I want to say about dementia, it is persistent. The symptoms don't go away. They may change over time, it doesn't go away, and it's progressive. Okay? Because sometimes people will have acute problems, acute confusion, which, and I'll throw out another term, and then I'll hopefully won't be using any more of the medical jargon, something called delirium, which is an acute problem. And people can get very, very confused all of a sudden. And often it's due to something like an infection or dehydration, or medications can cause it. And the good news about delirium is if someone has that, if you treat the underlying problem, they'll get better. The sort of not so good news is that people who have an underlying dementia are more likely to get delirium. So sometimes someone is having some minor problems and are developing a dementia, but it's not really recognized until they have a more acute problem, and people are thinking that's part of it. It's related, but probably not part of it, but it's bringing some of these other systems or symptoms that have existed more to everyone's attention. So I hope that makes some sense. So what I'd like to say is that dementia is not a normal part of aging. So it is there's a distinct difference. And what I'm going to try to do is tell you sort of what things you should be maybe not so concerned about and what things you might want to be more concerned about. So I'm going to start with the sort of normal things that happen as we age. So first of all, it often takes longer to learn or remember information. So things that you could just learn like that when you were younger, it's going to take you longer. It's also more difficult to focus, particularly in the midst of distractions. So what that means is that, yes, the 20-year-olds do multitask better than people as they get older. And there was one study I thought was interesting about texting and driving. Not that I recommend that at any age, but actually the 20-year-olds could do it pretty effectively in most cases. But as you age, each decade, it got harder and harder. And I know that I have found as I've gotten older, and I used to be the queen of multitasking, and I loved, my jobs where I could do like 100 things at once. Oh no, I'm trying to get this one thing done before I can move on to the next thing. So it does get a little harder as you get older. You may forget some information. You may forget someone's birthday and be absolutely mortified by that. You may have difficulty remembering the names of an acquaintance, not a close family member, but an acquaintance, and usually that will come to you later. You also may need more reminders or memory cues, so using things like calendars, sticky notes even, and even the speed dial on your phone, because you're not remembering the phone numbers like you used to. Also making an occasional bad decision, okay? Not routinely, occasional. And forgetting something. How many times have you walked in, gone into a room and you're like, what did I come in here for? That's a common occurrence as part of normal aging. But what do most of us do? We go back to where we started and try to retrace our steps. And in most cases, that's pretty successful. And we can figure out, oh yeah, I know I was there and this is what I need. And you go back and you're fine. You will also misplace things on occasion. And yes, the most common items are keys, and for women, purses. Where did I put it? And glasses. When I got glasses, I decided I was getting the kind that I would never have to take off, so I would not lose any time looking for them. There's an occasional problem finding a word. Not too long ago, I don't know what my husband and I were talking about, but I could not think of this word. I was pointing, and I was calling it sheetrock, but that's not it, and I could not think of that word. And the interesting thing is he couldn't think of it either. And by the next day, it was drywall. I could not think of the word drywall, but I thought of it independently the next day. So those things do happen, and it's sometimes just harder to retrieve that information. You also may have to think about, how do I get to a familiar place? It may not just be as automatic, but you don't get lost when you're going there. And you can generally complete activities, what we call instrumental activities of daily living, paying bills, cooking, all that without difficulty. And the other interesting part of it is that if you have a problem remembering something, you usually can remember what that problem was. Like, I can remember that I couldn't find the word for drywall. I couldn't come up with that name. So usually that's a clue that if you're remembering that you had a problem, it's probably normal aging. Does that make sense? Okay. So I'm going to start talking really fast now. So some possible indications it might be more than normal aging is the difficulty remembering recent events, appointments, and the problem is newly learned information, because we often have people coming in for an evaluation, and particularly the family members say, well, he remembers everything from 50 years ago. Well, that's exactly what we would expect, because that's in the memory at this point. It's getting the new information in that's the problem. Often that sort of problem presents as, forgetfulness or repetitiveness. So a person's asking the same question when you've just answered that question. Again, the person who might have a bigger problem than normal aging is only going to acknowledge a memory problem if specifically asked about it. And normally they say, but it's just like everyone else my age. So it's put in that framework for them. But often the family or friends are more concerned about this than the person is. They think it's normal, but the family and friends think it's more than that. And I'm getting the little sign here. So confusion about time of day, getting lost, particularly when driving, misplacing objects, and particularly finding them in unusual places. And difficulty completing those instrumental activities of daily living, difficulty with socialization, marked changes in personality, and frequent instances where there's poor judgment. And do those things always mean dementia? No, they do not always mean dementia. So it could be something else. It could be medication issues that affect cognition. It could be sleep issues. It could be a lot of different things, and even something that's called mild cognitive impairment, which is between normal aging and dementia. But what I want to say is if there's concern, it's really important to get it checked out. Sometimes we find problems, and that's what we do at the Memory Disorder Clinic. Look at the whole person and try to figure out what the problem is. And is it something that could be corrected? Is it something that could be not corrected, but maybe there's some things we could do to still help that person's functioning. So I really want to encourage you to get assistance for your loved ones if you think that there's an issue going on.